everyone. Welcome to our newest episode of Community Connection. I am one of your hosts, Victoria Olosha Casella, licensed professional counselor in Easton, PA, and my co-host, Mark Kenny from Chestnut Hill College. How are you, Mark?
I'm doing well, Vicki. How are you doing today?
Good. What do you think about this rainy weather out there last couple days?
Well, you know, it's like someone told me sometime, people didn't move to Pennsylvania to live in cities and suburbs. They lived here because of the farming. So this is exactly what we're supposed to get in November is rain and overcast skies so that, you know, the land is well, you know, the nutrients are getting in there. We got plenty of water supply. So the rest of us just have to live with it because, you know, that's the reason. That's what makes Pennsylvania so great.
Very positive outlook. It's important to be positive, right?
Yeah, particularly in October and November. Yes, it is.
For me, it's either nap weather, good nap weather, or jumping in the puddles with my kids. So, you know, but still try to look at it positive. So we are so looking forward to today's topic, a very serious topic of discussing domestic violence. Before we dive in, just our normal disclaimer for anyone who's listening or viewing this program. If you notice that you're going through a really difficult time, experiencing any mental health symptoms or any concerns on any level, we always strongly encourage you to reach out to your support system, whoever that might consist of, your medical doctor, therapist, crisis worker, whoever that might be. So we are going to give each one of our guests, and I know we normally have one, but it's such an important topic to discuss. We actually have two guests today. So we are going to allow each of them to introduce themselves, and then we will get to the questions. So Dr. Myers, we are going to start with you if that's okay. Can you just introduce yourself, your role, and just a little bit about what you do for our community?
Sure. My name's Aaron Myers. My clients probably know me better as Dr. Myers. I am a licensed psychologist at a local agency, Valier and Counseling Associates. And underneath that umbrella, we also have our specific company of forensic treatment services. That's where we specifically provide services to the community for perpetrators of both sexual and violent crimes, as well as we work closely with child protective services as well. So a lot of my clientele is involved in the system in some way. We also, through our private practice, we treat and work with a lot of victims too, and people with everyday mental health problems. I've been working at the agency for almost 6 years now. Some of that came in the form of my doctoral training while I was working on my doctorate. I actually did 2 years of practicum while I was at Valier and Counseling Associates. Then I left and completed my doctoral internship at Ancora Psychiatric Hospital in New Jersey, where I worked more with offenders and more severely mentally ill patients. A lot of forensic work, and that's where I'm at today.
Wonderful. Well, thank you so much for being with us today for this program.
Thanks for having me.
Sure. And Christy, please share with our viewers a little bit about yourself.
Sure. I'm Christy Yerk-Smith, and I run and practice at a small group private practice in Allentown by the name of Awareness to Change. I've been in practice solo for 12 years. Prior to that, I was working with a lot of different areas within the community. I've worked in community corrections. I've worked in inpatient treatment programs, outpatient treatment programs. So I bring roughly 25 unbelievable years in practice.
And you still love what you do, right?
I absolutely love
We
what
are
I
we
do.
are in this field because it is our passion, right?
Yes.
Okay, absolutely. Well, thank you for being here
Sure.
also with us. We appreciate it.
Thank you for having me.
Sure. Okay, so let's start off with just a definition. Dr. Myers, can you describe what domestic violence is?
Yeah, so when we say domestic violence, I think it's important to talk about a few specific things. And domestic violence typically is described as like coercive or controlling behavior. But I think it's important to also include and define how those behaviors can exist in a couple different domains, including like physical abuse. There can be psychological abuse, and a lot of times you think of like, um, the mental control or the emotional aspect of that. There can be financial abuse, so someone controlling the money or, finding ways to maintain power in that relationship with the finances. Social abuse, where someone's telling you who you can hang out with, who you can't hang out with, whether that be friends, family, coworkers. Um, then we have object abuse. This is probably one that people don't think about specifically, but people who will break your favorite items or punch holes in walls, um, steal things, take things from you, disable your car. Um, and
Many
then
threaten
lastly,
pets.
sorry?
Many threaten pets if
Yeah,
the
yeah,
partner has an attachment to a pet.
yeah. And then last, sexual violence. So I think it's important to really think about all of those categories when we talk about domestic violence, because it was actually interesting. I was just reading a study the other day that broke down what people understood domestic violence was per age group. And the one thing that really stood out to me was in the male category of ages 18 to 34, I think it was, they did, other than physical abuse, they didn't really consider psychological abuse to be a thing. Um, and they also didn't perceive non-consensual sex to be domestic violence. So I think all of those things have to be included under that umbrella of domestic violence. And I also think it's important to say here that a lot of times, especially as professionals, will sometimes describe domestic violence as like there's domestic violence in the relationship, right? Or there's domestic violence in the home. And I think it's important to say more specifically, especially when working with individuals, saying this person is a perpetrator of domestic violence, or this person is a victim of domestic violence, or I know a lot of people like to use the word survivor too there. But because when we phrase it that way, then we're putting the responsibility where it belongs, not on just the family has all of these domestic violence issues, right? It's the reason there's issues is because there is a perpetrator in the home or multiple perpetrators, and they hold the responsibility for those actions. So, and I also want to say, like, the psychological aspect of this is so important, and sometimes it's so insidious because a lot of times when victims come into treatment, they don't perceive the behavior of the perpetrator to be abusive. And when you actually put a label on it, it like opens up their eyes as to like what they're experiencing. And it always sticks in my mind. Like my boss was actually working with someone, and I think it just sums up this point of like, she said, I wish he would just hit me, because then I would actually have evidence of like the psychological trauma that I'm experiencing, because I can put, you know, like I can look at a bruise on my body and then it heals. Whereas the psychological stuff, you know, sometimes it's just these subtle comments over time that really can be so detrimental to your mental well-being. But those are much harder to put a finger on. So thinking of all of those categories as one is really important.
And I was just going to add to that, when you have a bruise, that provides you with proof to show someone that the abuse is occurring, where if it's mental and emotional, it's your word against theirs. It makes it so much more difficult. But yet that was such a very well thought out, detailed explanation. So thank you for that. Christy, would you, oh, I'm sorry, go ahead, Mark.
No, that's okay. I was going to just mention that one of the reasons why we're having our guest on is that even though we're almost at the end of October, that October is Domestic Violence Awareness Month. So I think that, you know, I know a lot of the agencies throughout the state have events by survivors, and so I think this is a very important conversation to have, because it's something that's happening every day around us. So I just wanted to start, if Christy, if you, anything you wanted to add. Dr. Myers gave us a very broad and a multifaceted sort of, you know, definition. If there anything that you wanted to add, and then we were going to ask you about statistics, but I've let you start with anything you want to add to that, and then you can transition into the statistics.
Well, I was glad that he made the link at the end there between victims or survivors saying, you know, sometimes I just wish I had the bruises. On the other side, I worked with, in the early 90s, what was called a batterers group. And when I worked with them, I would hear, well, I don't hit her, what's the big deal? And some of the partners that I heard from who were the victims said, I wish he would hit me because bruises go away, but the stuff he says that wounds my psyche just never goes away. So I think that's an important point.
Yes.
Some of the statistics that I have gathered that are eye-opening, but also kind of depressing, include the following. According to the CDC, 1 in 4 women and 1 in 7 men will experience violence by their intimate partner at some point in their lifetime. About 1 in 3 women and nearly 1 in 6 men experience some form of sexual violence. Women between the ages of 18 to 24 are the most commonly abused by an intimate partner. So they're the target demographic victims of abuse. 19% of domestic violence involves a weapon. Domestic victimization is highly correlated with depression and suicidal behavior. And only, unfortunately, 34% of people who are injured by their intimate partners ever receive medical care for their injuries. So those are some sobering statistics. And one of the points I would like to make also is that this is not a male on female crime exclusively. There are all kinds of intimate partnerships. And yes, men can be victims of abuse. It does not happen nearly as often as females. Gay and lesbian partnerships, there's domestic abuse. So it's not just the age-old traditional, you know, my husband is battering me kind of thing. So I wanted to make sure that is well known.
Yes, no, thank you. And I was wondering too, we were talking about age groups. for adolescents, particularly teenagers, sometimes
Yeah.
get missed in this conversation. So
Yes.
do you have any thoughts or anything you wish to share about what happens in that age range in terms of violence between partners and relationships?
Yeah, that's a very good point. Many students, middle school, sixth grade, which is sort of that latency between, that latent period between elementary school and beginning of adolescence, adulthood. Sixth graders can be experiencing some sort of control from these budding boyfriends or girlfriends. There are tons of junior high and high school students, college students who are victims of domestic violence and they don't even know it or understand it, because a lot of times that's a very insidious sort of introduction to control. You know, give me your phone. I need to see your phone, your texts that you're sending. Turn your location on. I need to know where you are at every time. And a lot of young adults, adolescents, feel sort of like that's a cute sign that he wants to know where I am every minute. But it's really grooming them for this very controlling behavior. And it's hard to see. Kids entering into relationships don't necessarily have the knowledge to understand that this is grooming them and this is controlling.
Well, thank you for sharing that, and hopefully that raises some awareness for members in our community. And as you said, sometimes if they're not aware, the adults around them noticing may be able to help in these types of situations. So thank you for sharing.
Of course, those children and adolescents have that role modeling going on in their adult caregivers relationships, because that very often happens too. They're groomed from an early age by seeing, you know, the intimate relationships between their caretakers be violent and controlling. So
well, thank you for sharing and alerting us to that aspect too, and sharing those statistics, because they are very sobering. And I know there's a lot of national and state and local groups that do a lot of advocacy, and maybe we can touch on that towards the end of our presentation, who are trying to take on those statistics and make some change. So go ahead, Vicki.
Oh, thank you. So Dr. Myers, back over to you. If you could tell us a little bit more about your experience in working with domestic violence cases and issues.
Sure. So I think where to start there is I've worked with perpetrators now for a little while, and I think going into and kind of tying this into with like what treatment is like most effective for this population is that like we have to definitely address the issues for what they are. And I think what I mean here is that I think there's common misconceptions when it comes to dealing with perpetrators of domestic violence of if they just go to anger management, that will solve the problem. And unfortunately, I feel like people who are treatment for these issues have kind of co-opted that word or term to make it seem like they're providing some sort of an effective treatment. Because I mean, there's nothing we love more, especially like in the era of CBT and managed care, to have a set amount of time that we can say definitively, like if you take this 12-week course, things are going to be different. And I think the programs that address the real issues are a lot of times still using that umbrella term of batter's intervention.
Yeah.
But you have to, our agency takes more of the approach of violence prevention. Like even if you're referred for like intimate partner violence, we're looking at violence as a whole when we're dealing with that person or that perpetrator. And unless your program is addressing violence specifically, then anything else is missing the problem. And I say that because anger management, I think, I think we probably all have seen that that movie a while back with Jack Nicholson and is that Adam Sandler who's in that as well?
Oh, the movie Anger Management.
Yeah.
Yeah.
And it's hilarious, and we have this like idea as a society that that's what you do for someone who breaks things or gets angry or becomes violent. And a lot of times anger isn't the issue. When you actually meet with perpetrators, there are plenty that aren't angry at all.
One of the things that I'm sorry to interrupt you, but one of the things that I have learned, actually I've taken trainings with your boss, is that this is not an anger management problem. Yes. They don't get angry and beat up their bosses when they're angry at work. They get angry and come home and take it out on their partners. So it is not an anger problem.
Right. And if it was, then you're right. Like they would be blowing up in all kinds of situations. But what you find is they have specific identified targets of when that violence occurs. And so what actually has to be addressed with violence related issues is their belief system. And we as an agency primarily focus on two specific beliefs that have to be in place for violence to occur. The first one, quite simply, is that violence has to be an option. So if you don't believe violence is okay, you're not going to be violent, right? Like I know plenty of people who would not even hurt a fly, right? Because they don't want to hurt anything. So you have to violence has to be an option. And then the other belief that we see is that there's some sort of belief tied in with the other person or the target having deserved it for some reason. So there's some sort of justification in that perpetrator's mind as to why that other person deserved to be hit, kicked, or taken advantage of in some way or controlled. So specifically with domestic violence, though, that is what has to be focused on. Like you have to be addressing those specific belief issues, and you can't put a timetable on how long it's going to take for someone to actually adjust those beliefs. And when we're talking about, especially more severe or violent offenders, we're not talking about a 12-week program being effective for that type of individual. Like there's been plenty of research on people involved with the system, and especially those with more pervasive personality issues. And like the effective timetable is sometimes upwards of 2 years before these issues are actually addressed. And so I think it's unfair, as clinicians and as society, and we're lying to ourselves if someone just attends therapy for 6 months and we think, oh, they're all better. And the other thing I want to add there is that I think a lot of times these issues get brought to the table when it comes to like couples counseling. And I'm actually going to argue that if there's a violent perpetrator in the home, you should not be doing couples counseling, because what can happen there is the therapist actually gets triangulated into the dynamic within the family. And because the perpetrator has all the power in that relationship, they get the therapist on their team. And now you have two people against the victim, which can be really problematic. And if any couples therapists happen to listen to this, I would highly encourage not doing any couples therapy and referring that couple, or specifically the perpetrator, to get violence treatment. And once those issues are addressed, then you can start working with the couple, but not until that issue is addressed. And you also have to be careful there, because perpetrators are really good at making it seem like things aren't so bad, or that I'm better now, right? I went through 10 weeks with my individual therapist, and I learned how narcissistic I am. And I know how much I was hurting you. So I'm sorry. And this is going to be all better. And for a victim or a family who, relies on that perpetrator, for financial reasons or, stability, it can be really easy to just hop right back into that dynamic, because especially when you're being victimized, you want that hope that things are going to change. But the reality is these things don't change unless there's a real dedication to treatment over a long period of time.
Excellent point.
Thank you so much. Those belief systems, I think that's really important. That whole concept of anger management does not solve the problem. One of the things that I share with my clients often is the anger iceberg. Do you know what I'm referring to? So specifically with anger, that's, I feel, is the best way to express it. Anger is what you see, but when you dive underneath, it's all those vulnerable emotions that need to be addressed, whatever it is, the depression, the anxiety, the grief. And that's, I'm assuming, part of what you're referring to, Dr. Myers, like those are the deeper issues, possibly some of the deeper issues that need to be addressed.
Yeah, well, one of the things that we primarily focus on in treatment too is focusing a lot on narcissism. And when I say that word, I don't just mean narcissistic personality disorder, but thinking about narcissism more on a spectrum, because you don't necessarily have to have narcissistic personality disorder to be violent. But what you often see is that offenders or perpetrators are often very entitled people, and display a lot of self-centered qualities that align closely with narcissism, not necessarily to the degree of the person, a lot of focus on self. And so, interestingly, I just gave a presentation not long ago, it would have been last Friday, on the ties between narcissism and violence, but it kind of goes into tying into your point, Vicki, of how, like, when there's an ego threat, right? When someone feels like they've been wronged or crossed, that's when aggression is more likely. And what you find is really when people get better, when they actually address these issues, they're actually more willing to be vulnerable. There's such a wall put up of like, things are going to be my way. And like a lot of the outward emotion is tied up in anger or dominance. And when you can get these individuals to get more in touch with what they're actually thinking and feeling, you notice that they're able to start connecting with people in different ways. So that iceberg metaphor, I think, is a good one, because a lot of times there are like a lot of more vulnerable emotions like fear or like hurt feelings, or betrayal that's like tied up within that. And it's a good, when you can get perpetrators to look deeper at those more vulnerable emotions, then they start to connect dots of like why they were becoming so aggressive.
Mm-hmm. Mm-hmm. Yeah.
Thank you.
Thank you.
Mhm.
Yeah. Christy, did you commented? Is there anything that you would like to add to that from your experience? And then we'll jump into your question then.
I thought that was a very good insight into the issue, and I couldn't help but think about how this is mirroring what he was saying. Was mirroring what's going on in society, in our country. You know, there's a lot of trauma that has gone unaddressed, and it's collectively becoming apparent.
Wow. Yeah. So we'll keep venturing. We can keep walking. We can maybe keep addressing as we go through. But yes, and so unresolved trauma is going to find a way of expression.
Yep.
Yep. And so if it's not expressed in a healthy way, it'll find another avenue of expression. Yeah. So this is something that this is very, very powerful, I think, because as I say to my students, particularly in my lifespan course, is that, the typical person doesn't get a chance to dive into like development and talk about these issues and think about these things because they have other things going on in their life. And this is the gift that our profession gives to our community and to our society, is that we have this knowledge that's wonderful to share so that people can see how this, add this to their own understanding of the world and broaden their understanding of the world and their own lives. So thank you both so far for all that you're sharing. We were going to ask you about how would you explain how come someone would stay in the situation? And I guess after you address that, I'd probably like you, from my experience, I did some trainings with Safe Berks before moving over here in the Lehigh Valley. If you want to address maybe what's the difficulty for a person leaving in these situations. So how come a person stays and then what makes it difficult for people to step out of these types of violent situations?
Yeah, because inevitably there are the questions that come when we read this about an incident in the paper or hear about it on TV. Well, why didn't she leave? Well, so number one, the biggest risk factor in a domestic violence situation is when a woman leaves. That is when she is most likely to be in the greatest danger and most likely to be killed. So she's attempting, and I'm using she, it could be anyone who's the victim. She's attempting to get away, but that's very dangerous. And it's not only dangerous for her, but if there's kids involved, pets involved, that sort of thing. So that's a huge one. There's other preventative factors such as socioeconomic issues. Many victims don't have the ability to support themselves and their children. And that is not necessarily getting any better in today's world. So that's a huge one. Just from the standpoint of cultural and religious constraints sometimes, we're depending upon our cultural outlook, we are conditioned to stay with partners, and that can create, a person leaving can create issues for their family in terms of their acceptance. There's lack of housing, which also correlates with the socioeconomic factor. But some other sort of more covert factors include the fact that many times perpetrators have been extremely skillful at isolating people from their partner. So by the time the partner looks around and takes an assessment of, okay, who do I have in my corner and who can support me through this, there's no one, because the isolation that that partner has experienced is total and absolute. You know, they don't have any more friends. Their family is cut off from them. So there's no support. Some partners say, well, I'd rather be in this relationship than be alone. It's lonely being alone. I do get some benefits out of being in this partnership. I do love my partner. I really love them. So why would I leave? Sometimes it also is, and this was addressed, sometimes it also is that my partner will change. You know, he's done the 12-week course and he can do, you know, the skills that we talked about, and he has apologized and he has been good for a month. But that doesn't create systemic change unless it's truly a long-term process and long-term commitment.
Can I just add something there? I think, you know, we take the approach as an agency that we actually don't allow our perpetrators to apologize, because that's a part of the grooming process that keeps people stuck in the situation. So
that
what
hearts and flowers cycle, you know.
Yes, right. And so what we ask them to do is state, okay, what are you, like, we uphold the value of accountability and responsibility. So, all right, so if you feel sorry about something, what are you saying that you did wrong? And then how are you going to work to correct it? And explain that instead of saying, I'm sorry, I'll never do it again. Because a lot of times that just ropes the victim right back into the same dynamic again.
Right.
Actions speak louder than words.
Yeah. Right. And I mean, to put it bluntly, like, we call apologies bullshit, because it's just not, it's totally being abusive all over again. But
It's more of a process. Completes that cycle. When I say hearts and flowers, it's the tension buildup, the release by the violence, and then it's the sorries and the flowers, and I won't do it again, and then it just keeps going round and round.
Yeah. And that's what you're mentioning. And there needs to be a systemic change, in a long term, and it's got to be a deep commitment. It can't be this surface level, simple. That person has to be willing to change, really change their beliefs and their values. For that other person, if that's really what they want.
Yeah, and society really needs to start seeing it differently. Instead of, you know, why doesn't she leave? Why don't we ask, well, why does he do that?
Excellent.
That is just as good of a question. And I think that some of the points our esteemed other guest is making it can be seen in a microcosm of that relationship, but a macrocosm of our biases and beliefs as the society.
Right. Oh yeah. I mean, that you could see, right, because the values and beliefs come from somewhere beyond ourselves.
Right.
And then, those who have the power and privilege in terms of then keeping certain values and beliefs in play or in a superior
Right.
role are also things we'd look at. And then you were mentioning and noticing the economic injustice in which that also holds people, and this you were saying she with women, but even in lower socioeconomic, hold people in places because they don't have resources or access to housing or access to livable wages or those things that would also help aid people in getting out of these difficult and violent relationships.
Right.
Mm-hmm. So it's really a multifaceted. We're looking here and we're recognizing it's actually a multifaceted piece to the whole topic we're talking about.
Yeah, if I can just add, there were two other points that I just thought of as Christy was speaking.
Mm-hmm.
You know, I think perpetrators are often really good at convincing their partners that they're the problem, that the victim is the problem. So like one person that I'm working with right now in a session earlier this week, he described to me that the main issue in his relationship with his partner was that she kept disappearing. If she wouldn't disappear, he wouldn't become so violent and aggressive. And I let him go on for a few minutes, and then I confronted that because I'm really going to uphold what you just said to me. And he had to think about it a little bit, and he was like, wait, no, I take that back. My abusive behavior is the main source of our problems. And I was like, you're right, because you need to stop pushing this off on her, because it's you who's had the multiple PFAs. It's you who has been arrested for harassment and continue to show stalking behavior. Mm-hmm. So we can't act like it's her that's the problem. You need to take ownership of this, because the reason why your relationship is in such turmoil is because you continue to cross that line. The other thing I want to add there, and I borrow this from Dr. Valier, is that part of a normal human behavior is getting back to normal, right? Like, we love stability and consistency. She recently, Dr. Valier recently wrote a book, and she used this metaphor of the Boston bombings to describe domestic violence in relationships and victims' behavior in relationships. And after the Boston Marathon bombings, what happened? You know, society said, oh, we're Boston strong, right? There were people who were out running races, you know, shortly thereafter. Everyone wanted to return to normal. And I think we have to keep that in mind in these abusive relationships, because victims don't want things to be out of sort. They don't sometimes want to leave. And that sense of normalcy and stability is actually quite normal human behavior. But we assume that, oh, okay, now there's violence in there, it's obvious that she should just get out, or that the victim should leave. And in reality, we often respond to these types of situations in very different ways than what we think. Mm-hmm. Mm-hmm. Where normalcy is what we really actually strive for. Mm-hmm. And well, so it makes it that much harder to go.
If you grow up in a family where that was normal, that's normal to you, and it feels familiar and comforting. Many women who do, you know, end up in shelters or transitional housing state that it feels really weird that there's no one there kind of yelling at them. So that's a good point.
Yeah. No, thank you both for continuing to dialogue and keep educating our public and getting us to look at this issue in new ways with new understandings, so that, you know, people have better understanding in the general public, because I think there's still a lot of misunderstanding, a lot of myths and stereotypes that we're walking around
Absolutely.
with that need to be dispelled and continued to be talked about and sent out there. So Vicki, did you want to?
Yeah, I'll
Go
continue.
ahead.
So Dr. Myers, you may have already touched base on this, but what do you think are the most important aspects to consider when providing treatment to perpetrators and the victims?
Yeah, well, I think we have to be willing, like in treatment, especially in domestic violence related issues, to recognize the dynamics that exist. And that there is a power differential in a relationship. So if you have, let's say a couple comes to your door as a clinician, and you know that the man in that relationship has had a PFA filed on him or has recorded or documented violence in his history, then we can't get caught up in that twist, as I was just talking about, of thinking that the victim in that situation is the main problem. They might be a part of that problem, but again, we have to make sure that we're putting responsibility and accountability with the person who's willing to cross that line and use violence in the relationship. I think also, more specifically, working with perpetrators, something that's really counter to how we're trained as clinicians is that when you work with perpetrators, you have to be willing to make people uncomfortable. We as clinicians are really comfortable at being comforting people, being helpers, right? Like we all learn about Carl Rogers and the unconditional positive regard. And I think a lot of us get into this field because that's how we are naturally socialized, right? And that's kind of what pulls us here. But to be an effective therapist with a perpetrator, you have to use confrontation, and you have to be willing to address, hey, like, this isn't making sense to me, what you're saying. Like, you keep saying that, like that with that example I gave earlier of this guy telling me the main source of our problems is her disappearing. Well, what role do you play in her disappearing? Maybe she wouldn't disappear if you treated her so poorly or treated her better when she was with you, right? Maybe the reason why she's not listening or answering your 50 phone calls in a day is because she's terrified of you. And you're not creating a safe environment when you're around her. So we can't get caught up in shifting that focus toward the person who has less power. That's a really important point as a clinician. And then going back to the other thing that I said, you got to be willing to make people uncomfortable. And you have to be willing to talk about the issues at hand and talk about violence or sexual violence very specifically. And I know there are plenty of clinicians too who don't want to talk or don't want to work with sex offenders. But a lot of times when there's domestic violence in a relationship, there's often boundary crossings when it comes to sex as well. And if you're not willing to go there, then you're really not addressing the real issues in that relationship. And I think, the scary thing about, working in a private practice, especially, or if someone isn't mandated for treatment, is that, at the end of the day, we as clinicians, we might have bills to pay, right? Like we want to make sure our keep coming back. We might be too confrontational, right? Because you want to get paid for that hour or whatever. But if you're really concerned about the real issues, then you can't be worried about whether this client's going to come back or not if you actually confront him on, hey, I think you were out of line in calling your partner this word, or we need to look at how you continue to be self-centered in these relationships. And the hard thing is, like, when you're dealing with someone who might be higher on that narcissism scale, like, they're going to have a tough time tolerating being placed in a negative light, because people who are on that higher end of the scale, they like to maintain that positive image, or they don't want to be seen as this bad person.
Yeah.
So you have to be willing to go there and sort through the image that they present, or the way that they might groom their family or society, to make it seem like, oh, these problems aren't as big as a deal as everyone's making them out to be. And it's like, well, actually, I have police records here of 15 times that they were called to your house because of things that you were doing. So help me understand that, right? But if you're not willing to go there as a therapist, you're not going to be very effective with this.
Right, right. So one of the things I'm hearing, even for our fellow colleagues out there, is that working with this population, you too have to have your awareness and your skills in place, because you could easily fall into the system too if you're not being focused and aware in these working relationships.
It's not for every clinician. And one of the other points that I'd like to make is that very often this behavior is aided and abetted by a substance use issue, or you know, substance abuse or misuse issue. So not only sometimes do you have to confront the perpetrating behavior, but there's an element of addiction, maybe with a substance, but also maybe with the behavior as well.
Yeah, that's a good point. And I'm glad that you brought that up. Substance use or alcohol use does increase the risks of violence occurring. However, going back to one of my earlier points, they are not the direct cause of violence, right? Like, you don't, you know, you don't read on the side of a Bud Light can, may cause you to be violent, right? Or you may rape someone if you drink this, right? You don't read that, right? Because you have to have the belief in place that violence is acceptable or that rape is okay in order to actually go through with that behavior.
Right.
That was an important point.
Yeah, and what that does, like you said, it's an option. It's one of their options before they put the vodka to their lips. So it is after.
Right. Yeah, go ahead.
Well, I was just wondering on the treatment on the victim side. I know that some shelters and agencies have moved to a trauma-informed care approach, has there been a shift in change in the philosophy of working with victims of intimate partner and domestic violence in recent years?
One of the caveats to that is it too often, I think, becomes a buzzword. So it's, oh, we're trauma informed, but they don't necessarily have a true grasp of what that means and what that looks like. So yes, they're attempting to be more trauma informed, but we all still have a long way to go.
And so what is the vision then, if that's the direction, even though maybe we're not there yet as a profession or working with this what is the vision that this is the direction that we should be going as a profession? What's the research or what's driving?
I don't have specific research statistics for that. I do know I can recall reading through and taking some trainings on trauma-informed treatment, that there is a higher correlation with treatment success when their treatment is trauma informed. And what that means, what success means, is concrete steps they've been able to take to remain in a violence-free household, or have not been in a violent relationship again. So those sorts of positive outcomes that you can look at and see, that you can measure. But in my opinion, with trauma-informed treatment, every inch forward is an inch forward. Are we ever going to get a partner who's a victim, you know, fully actualized and, you know, reflective on what they've been through? And no, we're going to move them forward an inch at a time, and that's good enough.
Thank you for sharing that, because I think sometimes the public isn't really familiar with the work that we do and how counseling works, how this whole process works.
True.
And it is sometimes small baby steps, isn't it? Like you go in for a couple of visits and come out and everything's good, right?
Poof.
So I think it's just good for our community to realize that, you know, this is a working collaborative, you know, in some cases, other cases, sometimes it's not at the beginning of collaborative, but you work towards that. But it's a process, and it's an ongoing process.
Yes.
So I think that's a good message for folks to know. Thank you for sharing that.
Sure.
I guess we're at the resources level. So
Yeah,
Christy, what are the resources in the Valley?
Yeah, we're coming up on about an hour now of the program. So how about we get into, and both of you obviously take the opportunity to share any resources from our community that you think would be helpful, and then also your contact information so our viewers can reach out to you.
Yeah,
sure. Well, very quickly, there are agencies that are available to help with all different types of resources, from housing to court advocacy to children's groups. And the gold standard in this area in the Lehigh Valley is Turning Point. So Turning Point of the Lehigh Valley, I believe their website is tplv.org. There's, I think you had mentioned the Berks County Domestic Violence Coalition. There, as a state resource, there's Pennsylvania Coalition Against Domestic Violence, PCADV. And I know that in Quakertown, there's another organization. The name escapes me, but I'm sure it would be on the PCADV website and list of resources. There's very many books and websites that can be helpful. breakthecycle.org, the Pennsylvania Coalition, chooserespect.org is one of them. So there's plenty of reputable websites that you can go to educate yourself some more. Also, you know, Dr. Valier's agency is an excellent resource. She does trainings. Dr. Myers, there's different types of agencies out there, but I would totally recommend the Valier agency. I've learned a lot from them. So
Appreciate that.
Thank you for sharing those resources.
Would you like to share your information, your contact
Sure.
information?
My group practice is called Awareness to Change, and our website is awareness, the number 2, and then change.org. You can find any of our therapists on Psychology Today. We're a group of, thus far, 5 women who have varying levels of experience and different interests and different specialties. So you can find out all about us on awareness number 2 change at .org.
Great. Thank you.
Yep.
And Dr. Myers, anything that you would like to share as far as resources and then your contact information, please?
Sure. Yeah. One other resource, that was a great list, Christy. One other resource that I find to be really helpful is the Domestic Violence Hotline.
Yeah.
They have a website that has great definitions of all the things that I talked about today, like describing domestic violence in a lot of very nuanced ways that can be helpful. Also, if you're seeking a therapist for these types of issues, you definitely want to seek out an agency that specializes in these issues, and that I think the better ones typically also have specific batterers intervention programs. They're going to be the ones that are most informed about these issues.
As opposed to anger management.
Yes. Yes. Exactly. Also, there's a book actually, I get no kickbacks for this, but one author that I rely on heavily is a guy by the name of Lundy Bancroft. His book is Why Does He Do That? And this book is an excellent resource if you're looking to understand these issues. I have most victims that I work with read this book, and I pull a lot of information from here. So a really good one.
Thank you.
I'll also give a quick shout out to my my boss just recently put out a book. It's called Understanding Victims of Interpersonal Violence. It's by Dr. Valier, and she goes and describes in great detail what a victim's experience is like. And I think it's probably one of the best books. There aren't a lot of books on victim behavior, and I think she sums it up really nicely. I'll also add that our agency this year, because of COVID hitting, we typically have a conference every year. We call it Right From the Start. But we had to offer it this year for the first time through webinar. But we're creating a library of trainings. There is a fee involved with that, but you can go on and learn much more about some of these specific topics that I've addressed today.
Are they open to the general public, Dr. Myers?
They are, yes.
Okay.
So anyone could go on to the library and access them. Some of them are just getting published now because our last ones occurred today, actually. But we've been putting on trainings for the last 3 weeks that are accessible to the public and for clinicians. So I think the best way to find me is to access our website. It's valiercounseling.com. It's VALLIERE counseling.com. And when you go to our clinicians page, you'll be able to find my information there. You can email me or feel free to call.
Wonderful. Thank you so much. Such a wonderful discussion. Any last thoughts from either one of you or Mark?
I'll turn it over to our guest.
Yes.
I don't have any last thoughts other than giving a plug for counseling period. Whether you're a batterer or victim or a normal American housewife, shall I say, anybody can benefit from counseling. So
Mhm.
that's my soapbox.
Dr. Myers, any last thoughts that you would like to share with our viewers?
Yeah, I think I'll just second that. I mean, I just hope people know that there are resources available. I know some situations can feel pretty dire, and it's like no one else is listening, and there are people out there for help. Just have to reach out. So I hope people know that. And I want to thank you two for putting this podcast on and having me today. This was a pretty cool opportunity, and I hope this continues to grow because I think this could be a great resource for our field. So thank you.
Thank you.
I second that.
Thank you very much. We very much appreciate this. It went a little longer than we expected, but so much information. I learned a lot today as well. So very beneficial. And I mean, if you know anyone or if you both are welcome to come back on for episodes in the future, if you would like to, all our guests are always welcome to come back on. So
Great.
thank you to our viewers, and please reach out to us or our guests if you are in need of anything. Thank you. Have a good evening.
Thank you. You too.
Thanks.
Bye now.
Bye-bye.